Which of the following maternal conditions is most likely associated with the observed polyhydramnios? A 28-year-old pregnant woman presents to her obstetrician for a routine prenatal visit. During the ultrasound examination, the physician notices an excessive amount of amniotic fluid surrounding the fetus. The fetus appears to have no structural abnormalities. Which of the following maternal conditions is most likely observed with this polyhydramnios? So maternal conditions. Um, okay. I don't know this one. I don't think it's preeclampsia. They say nothing about hypertension in this, so I don't think that could be the right answer. To me, nothing about placental abruption. I don't think that could be it either. I feel like it's just a routine exam. Like they would have some type of bleeding there, intrauterine infection, diabetes. I guess they don't say anything here about like what she could have, just like what basically causes polyhydramnios in a adult. Um, Diabetes, hypertension, intrauterine injection. I don't know. I'm leaning towards something. I'm leaning towards diabetes. I actually have no idea why. I don't know this one.
Okay. Final answer.
I'll go with final answer there.
Here we go. So what? Okay. So perfect. Okay. So they're just asking which one of these is associated with polyhydramnios, right? So
Mhm.
maternal diabetes, right, can give you. I just think of it. I mean, diabetes equals big baby equals more fluid. I
And
mean,
that's kind of what the thought process I had with that. I was like, I know it can cause macroglycemia, and I was like,
yeah,
maybe this causes because
yeah.
So yeah,
Uncontrolled maternal hyperglycemia can lead to fetal hyperglycemia and increase fetal urine production, which makes sense, right? You pee more
for
when you have
sure.
diabetes. But yeah, so I'm liking kind of the train of thought and kind of your test taking strategies, right? You're picking your gut, you're kind of looking around, doesn't the rest don't make sense, right? And then you kind of end up with where your answer is. But do you see how it's not like, oh, I'm 100%? You know what I'm trying to say?
Yeah, and so I was gonna tell you too. And one thing that maybe was a big point that I didn't talk about in the first part is that I was really making it a point this time to finish way early. Like
Yeah.
I wanted to finish it with like 20 minutes left because I remember finishing step one with like I had like no time to look over anything. And so I was like, I want to make sure that I have time. And so I think that also added to it is like I was like, I don't know, I'm just doing this one for right now. And I would like still finish with like 20 minutes left and like, I'm confident, and then I'd move on.
Yeah, for sure. And I think it's a fine balance when you're doing test taking strategy, just like you did on this question, right? Where you want to take your time, right, and kind of think through it out. I mean, I make you think out loud, of course, but when you're taking the test, obviously you have to talk to me or anything like that, of course. But in your mind, you're kind of really kind of taking your time thinking about it, right? Um, Doing your due diligence of each answer choice and then picking the right one. So yeah, no rush to finish fast. Remember, it's not about speed; it's about a balance of everything when you're taking a test.